is the 7th quarterly meeting of the Asian Dementia Friendly Pioneer Valley Initiative. Today we are talking about transportation services. I'm just asking you to put your name and organization in the chat, and then I'm going to give a brief overview of the Coordinated Public Transit Human Services Transportation Plan. This is a plan that PVPC does every few years, and I just want to make sure everybody knows about it. And then we have a few folks here to talk about some transportation services in the PVPC region, which is Hampden and Hampshire counties. We don't have all the services represented here, but it's just sort of to give you some ideas of what's out there and what's possible for your communities. And then we have Rachel Fichtenbaum here from MassMobility, and so she's going to sort of expand on those presentations to talk about some other options that are that communities from around the state are doing, and some resources that are available. And then we're doing updates and announcements at the end, and have an optional half hour at the very end as a roundtable, so to discuss if you're having issues with implementing your plan, if you've already completed it, and also to talk a little bit more about regional designation and how folks are feeling about that. So the Coordinated Public Transit and Human Services Transportation Plan is something that PVPC develops through the Transportation Department and the Municipal Planning Organization. The last one was updated in 2019, and I just wanted to present it here because this plan is supposed to serve as a roadmap for infrastructure and transportation services in our region. And it also, some of the grants should be supported by this plan. So it provides some data that you can use for grant applications. And also I'm hoping that we can integrate more of the findings that we're coming up with in the age and dementia friendly planning process in this plan going forward. The plan talks about various funding sources that are out there, and Rachel will talk a little bit more about these. The Mass DOT Community Transit Grant Program, which is open right now, I guess. There's a Mobility Assistance Program, Mobility for All pilot program, Helping Hand mini grant program for rural communities, and then a workforce transportation program. And it also gets into some programs for infrastructure, such as community challenge grants and the Complete Streets program, and looks at some the transportation networking companies, so Uber and Lyft. This plan is focused on older adults, people with disabilities, and low-income populations. So this is some older data, but it does show that the 65 to 84 population is growing, as we all know. So the red is 2012, the green is 2017, and the blue is the state. I'm sure these numbers have changed, and the plan will be updated next in 2023 with the new census data. This shows families in poverty, and again, it's a little bit older. Well, it says 2019, but it's probably a little bit older. And then also individuals with disabilities and where the highest concentrations of those populations are. So this information is really useful for planning for transit for disabled folks. It talks about the regional transit authorities that serve the region. So Franklin Regional Transit Authority, Worcester Regional Transit Authority, and the Pioneer Valley Transit Authority. Transportation offered by Councils on Aging, the Quaboag Connector, which you'll hear a little bit more about. The Hilltown Easy Ride is another shared service in the Hilltowns, and passenger rail. And then it also gets into medical transportation services. So these are, we're not talking about those as much today, but this plan does include some information on what's available now. And I thought this map would be really useful to look at. The green is the area served by the Franklin Regional Transit Authority. It's really a big part of our region, and not a lot of service there, but those communities in green are served by Franklin. And then the pink communities are served by the Worcester Regional Transit Authority. Munson and Tolland are not served by Regional Transit Authority at this time. Some of the diagonal lines show senior center van service and Regional Transit Authority senior van service. So Tolland and Munson offer COA van service. Pelham is served by Regional Transit Authority senior van service. So those are the different diagonal lines. So anyway, this is a useful map to sort of see how many different organizations are trying to work together to serve the transit needs of older adults and people with disabilities in the region. This plan does get into roadway infrastructure, just some of the walkability and bikeability that's important for older adults, and accessibility. So we're not going to talk about that today, but I just wanted to note that that's also in this plan. And part of the engagement process and some questions that we should all think about while we're doing the community assessments in the community, the age and dementia friendly community work is, what populations are left out of services? Do you feel any services don't work as intended? And do you feel that new services could better serve certain populations? So these are all questions that come up when we talk about transportation. So the next plan update is 2023. So I want to make sure that we share all the findings with the age and dementia friendly community assessments on any unmet transportation needs. I can share those with staff in the transportation department to make sure they know what we've learned from community members. And then as they get into the updating process, I'm going to make sure that this collaborative email list and all the councils on aging know about opportunities for engagement in that process. So I'm going to stop sharing now. And any quick questions on that? Otherwise, we can get into the presentations. Okay, don't see any, and feel free to unmute if you don't. Okay. So next on the agenda is PVTA folks. So Ben and Leland, and you're able to share your screens if you would like.
Okay, good morning. Actually, I think we're going to start off with, I think Paul, the Director of Transit Operations, was going to start off with some information for us here.
Great.
Okay, hold on.
So just in general context, we provide DialARide service to seniors over the age of 60 in all of our member communities throughout the PVTA service area. Our area ranges as far as Northampton and Williamsburg in the north, and includes to the state line in Connecticut, with Connecticut, from Palmer and Ware in the east to Westfield and westernmost is East Hampton on that side. So it's a significant area, roughly 600 square miles. And those DialARide trips, excuse me, are available to all seniors in the area Monday now through Saturday. We're enacting a pilot program. So between now and November 1st, DialARide service is available from 8 a.m. to 7 p.m. Monday through Saturday. The only challenge with DialARide trips is those trips are subject to availability. So there is a potential that individuals may be bumped if there is demand on the ADA side. ADA, unfortunately, is We have to give preference to ADA riders. It's a federal mandate. DialARide is an ancillary service that we add. I would note, however, that we rarely are denying any trips on DialARide. And typically what does happen if a trip needs to be moved, we try to reschedule it with the operator, with the rider, which is why we extended the service to 7 p.m. and to include Saturday so that we could take trips off our peak time and encourage seniors who are using the service to shop at less busy times. Generally, we give priority to medical trips on the DialARide service, and those are typically not bumped. And we also provide several pilots with councils on aging throughout the area. And we provide transportation through those councils on aging for DialARide trips that may have slightly different service hours. It would be up to the individual council on aging. And I think that's the quick and dirty overview. We're happy to work with organizations across our service area to help provide more reliable transportation or more dedicated service. For example, in the town of Ware, we're looking to implement a service that would provide medical trips to replace some of the access that folks had to Bay State Mary Lane, and provide access to those folks to Bay State Wing and Bay State Wing facilities in Belchertown as well. So we're more than willing to look at the situation and work with each member community to address service needs in their area. We also, I'm sorry, go ahead, Becky.
I was just wondering if you could say a little bit more about the pilots with the councils on aging. Does that provide them funding to use their vans or
it can work one of several ways. We provide operational funding through those grants that provides 50% match for funding. And we also have the ability to apply for grants for vehicles at an 80-20 match for those individual councils on aging. The councils on aging would also be eligible, I believe, for most 5310 funds on their own if they wanted to apply it separately. But they could certainly apply through us if they have any kind of a relationship with PVTA, and that would include simply being a member community.
Okay. Thanks.
And then we also do offer a senior fare-free service on Tuesdays. So they just need to have a valid senior ID, and they may need to, they need to apply through, we do outreaches at the senior centers to get them the senior IDs and the senior passes.
Okay. Is there any talk of expanding that fare-free service? At
this point, no. It does seem to encourage ridership across the system. So I think, it certainly encourages ridership on Tuesdays, but it's also helped to introduce seniors to the system. And then finally, I guess the last piece also that I did want to mention is that we also offer travel training services to any senior center throughout our service area. And the travel training doesn't necessarily have to be just for seniors. We're more than happy to help individuals who are unsure of how to access the fixed route or access PVTA in general to understand how to use our service and ride the system to get to and from locations across the Pioneer Valley.
Great. So James has a question. Are residents of senior housing engaged and aware of the fare-free service?
We did, as the fare-free rolled out in 2019 and 20, just prior to the pandemic, we probably did about 70 outreaches across the area. So I would say prior, they were probably more aware. I would imagine that we'll need to do more outreach as the pandemic recedes and, folks' memories have faded. But certainly, we are more than happy to come out and do more outreaches and provide more educational service.
Great, and that's throughout your region, right? The Tuesdays.
That is throughout, yeah, that's anywhere that there's a fixed route, seniors can ride free on Tuesdays.
Okay. Great.
And so before Leland talks about the travel training, I just wanted to briefly show how you can access information on the various hours of service for each community. So I'm just going to share my screen for a moment.
Sure.
See if I can, here we go. Okay, so pvta.com. It's going to be under access and services, mobility impaired. And then when you're here, you scroll down, full service paratransit hours by community, and we have a large print version as well. And when they look at this, this will outline the various ADA available services. So if you're eligible for ADA, whatever town you live in, this outlines the various times those are available and any notes there. And then DialARide, DARs for DialARide. So that will help anyone who is interested in whatever specific hours are to their community. So hopefully that will help. And then I believe Leland was going to talk about briefly about the travel training that we offer.
Great.
Hello, I'm Leland and I'm the transit navigation instructor with PVTA. That's my program, is the travel training program. As Paul briefly mentioned, it's a great program for seniors or anybody with a mobility impairment who just wants to learn how to use the fixed route bus. So I can come out and I can teach you how to get from your home or from wherever and to get on the bus, how to pay for the bus, how to find bus stops, how to use navigation apps, how to read bus schedules. And we just do the, we just take the bus and I show you how to get to you wherever you need to go within our system. So we can do that on any fixed route bus within our member communities. And if you have any further questions about that, or if it's anything that you're interested in, feel free to reach out to me. I will put my contact information in the chat. And it's really a great option if you're either giving up driving, or if you don't want to rely on rides from friends or family anymore. If you're looking for that independence, it's a great option to learn how to ride the fixed route bus on your own. It's also a cheaper option than using our paratransit or senior service, because with the public bus using your senior discount ID, you can take the bus for 75 cents. So not only is it a cheaper option, but also gives you that greater independence. I'll hand you back over to Ben.
It should be okay. Thanks, Leland. I just wanted to mention, of course, anyone who's interested, we talked about the discount pass for seniors. That would be handled through our through the customer service at the main transit hub here downtown at Union Station. So, but I think that's all the time
and
we
we can
have.
also schedule outreaches at local senior centers.
Right, and correct me if I'm wrong, Paul, but we could actually have them apply there.
At the senior center, yes.
Yep. Okay. So that will help any who.
That's obviously going to be dependent upon each senior center's regulations and rules as we return from COVID. So there's a hodgepodge of access requirements across the region right now, but we're more than willing to work with member communities to arrange outreaches and ensure that seniors can access the service. And I did notice somebody had also asked a question regarding if the drivers receive dementia training and other cognitive impairments. Paratransit drivers do receive general training on working with folks with disabilities. I don't believe at the moment that we include a significant amount of training on dealing with folks with dementia. But I do know that MV does deal with that issue and does address kind of micro trainings to the drivers, because of course, you know, we do provide a significant amount of service to older folks who may or may not have dementia or other cognitive impairments. So they are aware of how to deal with folks with cognitive impairments in general. And they do some training on dementia care, but it's not, I wouldn't say it's an overwhelmingly inclusive training, but it is, they are aware of the issue and they do work with folks in that capacity.
Yeah, I know the Alzheimer's Association was offering some trainings for, especially for drivers. I see a couple of questions and I think we have time for a couple of questions. Leslie asked, who should we contact for outreach at senior centers? Would that be you, Ben, or?
The primary person to contact for outreach at senior centers would be Brandy Lamore.
Okay.
And let me just double check the email there.
Okay, yeah, if you could put that in the chat, that would be great. And A couple other questions.
Becky, you can also, anybody can reach out to me about outreach at senior centers. I coordinate with Brandy on that.
Okay, great.
And then the
Chad,
question, oh, sorry.
go ahead.
Just wanted to mention the question about cash or tickets. We accept both on the vans.
Okay. Chad asked, can you take my picture or issue a pass so you don't have to go to, so he doesn't have to go to PVTA to get that?
That could be arranged at a senior center outreach.
Okay,
We would not go to someone's home.
okay, yeah. All right, and then okay, and Rachel said she'll talk about the Alzheimer's Association trainings later. Great, well, thank you for coming. And next we have Jen from QVCDC to talk about the Quaboag Connector.
Hi, everyone. I'm just going to share a couple of slides with you. And let's do this. That's right. So my name is Jen Healy. I am the Rural Transit Program Manager at Quaboag Valley Community Development Corporation. So I manage the Quaboag Connector and some of our other transportation initiatives. So the Quaboag Connector was started in January of 2017 after several years of discussing needing a transportation solution in our region. And it is a partnership between the Quaboag Valley CDC and the town of Ware. So this here is a map of our service area. The towns shaded in purple are currently served, and the towns shaded pink are the ones that we hope to expand into in the future. Actually, we have expanded into North Brookfield this past year, but we are hoping to continue to cover more of the area. And the Quaboag Connector is a demand response service. Its hours are included on this slide, so folks can call in and make an appointment with us, and we'll pick you up at your home or your original destination and take you to where you need to go. And if you need a ride back, we will take you there as well. It is curb to curb, not door to door, so folks do have to be able to get themselves to and into the vehicle, and then out of the vehicle into their destination. But we will go to any destination in this service area. And in addition to that service, we also have recently launched the Route 9 fixed route shuttle, which currently runs on Saturdays. We're hoping to expand those hours in the future, but it runs along Route 9 and works like a public bus. It stops at shopping destinations, senior centers, sort of important destinations in our region. And then we also work with the PVTA on the Ware Palmer Flex route and the B79 Amherst to Worcester route. And then lastly, we have a wonderful team of dispatch staff who frequently help folks figure out how to get where they need to go by coordinating with multiple services in the area. So if folks have a question about, if they have an appointment somewhere and they say, I need to be at this location at this time, our dispatch staff can help them figure out how to get them there, even if they need to use maybe more than one service that I have listed here. The system for riding the Quaboag Connector is pretty simple. All rides are $2 one way, anywhere in the service area. And to use it, folks just need to call our dispatch team. The number is right there. It's also included on our website, which I'll include at the end. And a member of the dispatch team will work with them and note any important information such as mobility needs for their trip. And then they will get an appointment, and one of our drivers will pick them up at the scheduled time and collect their fare. And this is just a list of sort of where you can go using our services. The Quaboag Connector, like I said, anywhere in the service area. These are some of the areas that the Route 9 shuttle goes to, and we can connect to an important piece of this, I think, is that we often help folks connect to the PVTA or the WRTA, so that they can continue on to the western part of the state or onto Worcester and to Boston from there. So I would stress that if folks in the area are trying to figure out how they can get somewhere, calling our dispatch team is an excellent way to try and navigate some of these services. And then lastly, we also have a program for folks that are specifically going to work in Palmer. They can ride for half price if they qualify. If they income qualify, we will take them to and from work or employment related activities for half the price of a ride, which would be $1 each way. And then lastly, I would just say that, you know, as I've mentioned, our dispatch team is really great, and we try to share as many resources as we possibly can. So if folks give us a call, we can usually figure out how to help them move around the region. I would say that as we, you know, to discuss some challenges that we are currently having, we do have a driver shortage, so that has limited our capacity a little bit. But despite those challenges and the challenges with the pandemic, we have still grown and expanded quite a bit, and we are always looking to collaborate and try to cater our services as best we can to the needs of folks in the region. We will take anybody, anyone can ride with us, but we do prioritize seniors, people with disabilities, and folks who are low income. So we try to make sure that those folks can get where they need to be. And I would say that despite the pandemic, you know, the first month that we started the Quaboag Connector back in 2017, I think we took 17 people. And last month we took 1,400 people to where they need to go in the region, and 500 of those folks were over 60. So for folks in the Quaboag Valley, the Quaboag Connector is a great resource if they need a ride, and also a great resource if they need information about moving around the region. Even if the ride doesn't end up being with us, we want to do our best to try and help folks access the community resources they need.
Jen, I see Chad was asking what how much capacity you use. So like how many people per bus, and yeah, also what's the funding source?
Sure. So we have a variety of vehicles that we use. I would say generally speaking on the connector, the bus can take maximum 4 people at one time and probably 2 wheelchairs at once. But that's generally speaking. We have some larger vehicles and some smaller as well. And then the funding sources, we're very fortunate to have some wonderful collaborations with many organizations in the region. As mentioned, it is a partnership between QVCDC and the town of Ware. And so we do have some municipal funds from a few communities in our region. We're also funded by the Health Foundation of Central Mass through a synergy grant from them that has really sort of propelled some of our expansion. Bay State Health has been a partner from the very beginning as well, and then several others. So it's a bit of a complicated layered funding scheme, but those are sort of some of the big players there. And I would invite Sheila. Oh, sure.
You also get the Municipal Transit grant funding? Yep. Okay.
MassDOT as well, yep. And if I'm missing any, Sheila, feel free to jump in, correct me.
Great job, Jen. I think you've hit all of them. Thank you.
Thank you. Any other questions for Jen before the next speaker?
Just congratulations on a job well done.
Thank you.
Yeah, I think that the connector is a really great example of a collaborative process that really fills a lot of needs. And the other regional program that we don't have represented here, I don't think, unless anyone's here from the Hill Towns, is the Hilltown ride service that's through the Hilltown Community Development Corporation. So that's another good one to look at. Next we have let's see, I think we have Northampton next. Just pull up your slides. Sorry, I have many documents here. Yeah, so we're gonna hear from Northampton Neighbors, Diane Portella, and Diane, I will share your slides right now. Okay.
Hi, excuse me. Hi, can you hear me okay? I'm not going to put my face on because it'll shut everybody down. So apologies for that. So yes, we are Northampton Neighbors. We are a volunteer organization. One of the things we spoke about, Becky, was that our volunteers for Northampton Neighbors are fully vetted and insured. So for that piece, we feel pretty confident. We don't have enough volunteers. We always want more volunteers, particularly volunteer drivers, because that is one of our biggest things. If you go on to the next slide, the thing with Northampton Neighbors is we are a membership-driven organization. And we are a member engaged organization. So if a person lives in Northampton, Florence, or Leeds and are 55 or older, they are eligible to receive services like transportation. At this point, we are offering transportation for essential services only, like medical and food security. And we do require that people be vaccinated, wear a mask, sit in the back seat, social distance, and we have a new set of health screening questions that we ask people to sort of just self-monitor in the morning or day of their trip. And if they are not feeling well, either volunteer or member, to just cancel it. And the next slide is a very long slide, just like this one, but it does sort of review what I just said. And also the important thing to remember is, as we ask a member to call us and give us, we need about a week these days to make an arrangement. So we are not a quick responder at this point on transportation needs. One thing that is good when we can make a trip possible, it is door to door. And it's normally one person in a car with one driver. They're individual trips. The next slide, please, talks about a tricky thing for some right now is that with Northampton Neighbors, as you register, it is free to register. Anybody anywhere can register in Northampton Neighbors to receive services. You do need to live, as I said, in Northampton, Florence, or Leeds, and you must have had a welcome visit. That's when a volunteer comes out to your home to meet you, learn about what you're about, and tell you a little bit of what we are about. And then after having that welcome visit, you can then request services. But what we're finding right now is as people are opening up again, a challenge for us right now is we are meeting new people, which is great. But if we've got to first schedule a welcome visit before we can schedule a transportation request, it's adding extra days to that process. So, we encourage folks to join Northampton Neighbors and have a welcome visit, and then you'll be ready to go should you need a service. So, and bottom line, because we are a young organization and a small organization, we can be pretty nimble. So we really encourage people to call us and say what they need and what they want. And often we can work it out. So that's that's Northampton Neighbors. And I am open to questions. And I encourage you to visit our website for more information too.
Thanks, Diane. Any questions for Diane? I guess I have one just to start. Do you recommend that people go first to Northampton Senior Services or PVTA to see, to try to use those services, or do you just sort of take whoever calls?
We take whoever calls. We do, however, recommend, oftentimes we do recommend the senior center. We refer back to them for times when it is an urgent need, particularly for a medical service or something like that. And the person hasn't had those necessary pieces of a welcome visit and a registration. So it's a lot of back and forth. And oddly enough, I'm so pleased to hear about this travel training program because that's one of our summer focuses, which is training people on how to use the PVTA. So you'll be hearing from us, Mr. Zach, for sure.
Great. And Leslie's asking, how do you collaborate with the senior centers in Northampton, Leeds, and Florence? Well, there's just one senior center, right, in Northampton?
Correct.
Yes, and we are fortunate these days. We're both just